Hello everyone, thank you so much for coming. My name is Nellie.
And I'm Joanne, and over the summer we interned at FRESH, which stands for Females Rising Through Education, Support, and Health. So as we know, South Africa has one of the largest HIV epidemics in the world, where women are 3 to 6 times more likely to be infected with HIV than their male counterparts. Now the FRESH study is located in Umlazi Township, where HIV prevalence rates in young women rise from less than 1% at age 15 to 66% at age 23. So the FRESH study has targeted this key population and has decided to enroll women who are 18 to 23 years old in Umlazi who are HIV negative and who are at a high risk of HIV infection. And so this study is twofold. The first part is basic science research, trying to understand more about HIV infection in the early stages. And the second part is an empowerment program for the woman in order to provide them with skills and resources for the future.
So our primary project for the summer was to design a plan for the evaluation of PrEP at FRESH. PrEP stands for pre-exposure prophylaxis, and it is the daily dose pill for HIV prevention. So FRESH started offering PrEP to its participants about a year ago in June 2018, yet has still not seen any significant reduction in the HIV incidence rate. So basically, even though all of the participants have access to a pill that would prevent HIV infection, the same number of them are still getting infected. So FRESH wants to investigate why this is happening and what it can do to help improve this adherence to PrEP. So Joanne and I began our project by doing a literature review of PrEP in order to understand the landscape and the landscape of what we're working on. And we then moved on to understanding the distribution of PrEP at FRESH and how that works within the program. Once that was understood, we were able to move on to plan our mixed method approach. So this is twofold. The first part is a quantitative aspect, and this uses statistics of uptake and adherence from surveys and other data sources to understand the issues that we're facing at PrEP. The second part, what we really focused on, is the qualitative portion of the study, and this uses interviews and group discussions to really dive deeper into the issues that these women are facing and why they can't adhere to PrEP. And a really key part of our project was engaging the community. So Joanne and I are 2 college students from America that have only been in South Africa for 8 weeks, so we don't quite understand the culture that we're working in. So we worked with multiple community working groups composed of key stakeholders in the community of Umlazi, and we discussed the plan with them for our qualitative study in order to ensure that the data we're collecting is actually relevant to the community we're collecting it in. And the final product for our internship was to create an amendment to the FRESH protocol and submit this to the local ethics board for approval.
So beginning with our literature review, we have found PrEP to be effective in multiple studies, such as the bottom 2 studies, If We're Gay and Proud, that were primarily dealing with gay men in countries such as the US, Canada, France. But when these same studies were replicated in young African women, the results were shocking because the reduction in infection was nearly 0%. And so this begs the question, does PrEP just not work for African women? And the short answer to that is no. PrEP does work, but if you take it. So what the researchers found was that the women in these studies were not adhering to the daily pill regimen of PrEP that is necessary for it to be effective. And they found many barriers to PrEP adherence, including HIV stigma, where the woman did not want it to be mistaken of taking ARVs instead of PrEP, lack of information about PrEP and its efficacy, unsupportive partners who did not let the woman take PrEP, and even just the mere fact of young, uninfected, healthy women having to take a pill every day deters them away from taking it. So in later studies, when the PrEP adherence levels were higher, it was proven in fact that yes, PrEP does work in African women. But we wanted to delve a little bit deeper into this PrEP adherence dilemma at FRESH and ask our participants what their barriers are.
Yes, so here on the left, you can see a diagram of the distribution of PrEP at Fresh. So at their first visit, every single participant is offered PrEP, and 72% of them consent and say, yes, I do want to take PrEP. After consenting, 40% of them show up for their initial dispensing and get their first monthly supply of pills. From there, the numbers decrease at each month until only 4% are going to get their PrEP at the 4th month. While these numbers do seem low, to put it in perspective, the HIV Trial Network is doing a study with 4,000 South African women, and their PrEP uptake at initial dispensing was only 5%. So when comparing Fresh to this, Fresh's uptake of 40% is 8-fold higher than this. While this is something that Fresh can be proud of, it still means that we need to improve and try and increase these numbers as much as we can. Because for each participant that is not taking PrEP, they're at an extremely high risk of HIV infection. Just since the introduction of PrEP in June 2018, about a year ago, there have been 8 infections. And these are especially frustrating knowing that these women had access to a pill that could have prevented this infection. So the overall message is that we do need to increase PrEP uptake. But in order to do that, we need to understand the problems to PrEP uptake that these women are facing. So currently at Fresh, a PrEP survey is administered at around 15 weeks, which asks a variety of questions about PrEP, one of which asks what are their top 3 worries about taking PrEP. And these women responded and said that 78% of them said that side effects was one of their top 3 worries. 76% said taking a pill every day, and 41% said someone finding their PrEP and thinking that they're HIV positive. So one of the themes that can be taken from these results is that these women are having problems with the form of PrEP as a pill. So we also asked the participants if they could choose their ideal way of taking PrEP, what they would prefer, and only 11% said they would prefer a daily pill, while 75% said they would prefer an injection every 3 months. So what we can learn from this is that PrEP may not be the ideal solution to curb the HIV epidemic here in South Africa, but it is what we are working with at the moment, and thus it is necessary that we work as well as we can to improve the adherence to PrEP and prevent as many infections as possible.
So while the survey does provide us with valuable information about PrEP at Fresh, it's insufficient to provide a real deep dive into the reasons of why these participants are not taking the pill every day. So we wanted to plan focus group discussions and in-depth interviews with the participants. But before we could do that, we wanted to understand the culture and community we were working in. And so we met with members of the community, both the Fresh staff and the Community Advisory Board of Fresh at HPP, who both of them live in Umlazi. They know the struggles these women face, and they helped advise us through community working group meetings as to who we should interview and what should we ask them.
So with the help of the community working groups, we designed a 2-part plan for this qualitative part of our study. So the first part are in-depth interviews, and these will be with individual Fresh participants, some of which are with HIV-negative participants, some of whom said yes to PrEP and some of whom said no. We will also be interviewing HIV-positive Fresh participants who were detected after they were offered PrEP. The other half of the qualitative study will be focus group discussions, which will be held with groups of participants, some number of groups with people who said yes, and some with participants who said no to PrEP.
And so after we decided who we were going to interview, we had to create the questionnaires. And with the help of the community working groups, they really highlighted for us some cultural nuances that we had overlooked. So for example, they mentioned that we should ask about the impact of social media when we're discussing what the participants know about PrEP. Or the fact that we should use the phrase drink a pill instead of take a pill because that's what they're accustomed to hearing. They also mentioned to gain richer, deeper discussions, we should avoid yes-no questions. And in phrasing our questions, we should avoid blaming the participants and make them feel comfortable in addressing why they didn't take the pill. And lastly, the community working groups really focused on mentioning external influences in the lives of these women, such as their families, their boyfriends, so that we can truly get a psychosocial assessment and a holistic approach of what's going on.
In addition to our prep project, we were able to use our skill sets in coding and Excel to give back to the FRESH program. So we wrote R code to streamline data processes and automate report generation. We archived data files so we could move boxes out of the crowded office, and we helped to build additional databases in REDCap to record the data.
And so one of the best parts of our FRESH experience was definitely interacting with the FRESH participants, whether that be at graduation or in the classroom as they presented their showcases or on field trips. The one to the right, we went to Coca-Cola with them. So it was truly an incredible opportunity for us to have that cross-cultural exchange with young women the same age as us. And it was truly inspiring to see how much of an impact FRESH has made in the lives of these ladies. And so being at FRESH, we have definitely been able to have a deep dive into the prevention aspect of HIV research, and we have learned about the downfalls of adhering to PrEP and the barriers our women face. And so while discussing that side of the coin, we also have to discuss HIV cure and research, and that is what our fellow lab interns have been working on over the summer.